So good morning and welcome, and thank you all for taking the time to be here this morning. Very important event, and we're very excited to support what's going to occur this week. As we all know, the past 14 months have been very tough navigating the pandemic overall, and for everyone in many different ways. Luckily, though, we do have 3 very effective vaccines that will hopefully show us the light outside of that, or to head us out of that tunnel here soon. Here at the Memorial Coliseum, our department has been vaccinating since January 13th, for which I need to say a big thank you to Randy Brown, Jean Langwell, and their team. But we're narrowing in on 40,000 vaccinations at this site, and we'll likely hit that this week or early next week. Overall, with all of the sites vaccinated in Allen County, nearly 275,000 doses have been given to Allen County residents, and of those, 130,000 people are now, or more, are now fully vaccinated in Allen County. That's over 40% of the vaccine-eligible population in our county who are now fully vaccinated, and we hope to continue. This is excellent progress, but we do have more work to do. We are very excited to announce and support the mobile vaccination clinic that is going to occur this week at McMillen Park. As we all know, and as our data shows us, going to various communities is the most successful, and it works. Over the past month, following several targeted vaccination clinic operations throughout the community and in the community, we've seen a significant uptick in vaccination rates in some of our lowest vaccinated zip codes. This is such great news, and we hope with this event and others to come, we'll continue to see this trend. We're grateful that this site will provide an opportunity for easy access for community vaccinations, and we look forward to seeing those zip codes rise over the next few weeks. I'd like to turn this over to Shane Hatchett, who is the Chief of Staff with the State Department of Health, to provide some information, and then we have a number of speakers to provide information to you today as well. So again, thank you, and thank you, Shane.
Thank you, Mindy, and all of you who are hosting us here today, and everyone who's been involved in the vaccination efforts for COVID-19 vaccines across the state, and especially here in Allen County. If you'll indulge me for a moment, I really would be remiss if I did not take an opportunity to recognize the incredible efforts of Mindy and her team here at the Allen County Health Department for not only this clinic, but the myriad other services they've done over the last 14, 15 months with respect to the pandemic. Whether it was testing sites, contact tracing, you name it, they've really gone above and beyond and have been fantastic partners with the state. Across the state, we are seeing the results of communities coming together to get their membership vaccinated, which results in lower positivity rates, fewer hospitalizations, and fewer deaths. This is the progress that we have all worked so hard for over the last 15 months, and that is definitely worth celebrating. For instance, more than 2.4 million people in Indiana are fully vaccinated, including the nearly 130,000 here in Allen County, which is approximately 34% of all residents. Almost 2.6 million people statewide have received a first dose of vaccine, including almost 140,000 here in Allen County. We're seeing increases in vaccination rates among our minority communities in large part due to clinics like this, as well as our FEMA mass vaccination site in Gary, Indiana. The vaccination rates among our Hispanic and Black Hoosiers is increasing, and for Asians, the rate is on par with state averages. Later today, we will issue a phone alert to raise awareness of the clinic and our 9 a.m. to 6 p.m. hours today through Saturday, which we believe will drive up interest and participation in that clinic. We've seen the excitement among families with children ages 12 to 15 since that age group recently became eligible for Pfizer vaccine. I've heard reports from clinics around the state that have seen a steady stream of young people coming to get vaccinated so they no longer have to quarantine once they are fully immunized, so long as they do not develop symptoms. For adolescents who have missed so many activities they love and important rites of passage, this is a game changer and helps them get back to normal sooner. The progress that we are seeing is incredibly exciting, but we know that Indiana still has some time yet before this pandemic is in the rearview mirror where it belongs. To date, Only 40% of the eligible population is fully vaccinated statewide, which leaves 60% who have not had a single dose. We continue to battle hesitancy and misinformation about the vaccines, which is why I want to state unequivocally for the record that they do not contain a microchip, they do not alter your DNA, and they will not impact your fertility, which are all things we have seen on social media and heard in community conversations. They do, however, contain life-saving preventive inoculations that will get us back to normal. All 3 vaccines have been rigorously studied and have been deemed to be safe and effective in the populations for which they are approved. As we continue to see new cases of COVID across the state, it's important to remember that over 99% of the individuals who are being hospitalized with COVID right now have not been immunized. The vaccines are a path forward, and we encourage everyone who's on the fence to get vaccinated as soon as possible. The majority of clinics statewide are now taking walk-ins, or you can register ahead of time online at ourshot.in.gov or by calling the 211 hotline. We have a Spanish language line at 211, and our website is available in Spanish and Burmese. Finally, I want to remind you that we do not require identification for our clinics. All we ask is for your name and date of birth so that we can ensure that you get your second dose as well, if that's appropriate. Again, thank you for having us here, and we hope to see a fantastic turnout this week. Please get vaccinated and encourage your loved ones to do the same. It may just save their life.
First, I'd like to thank you for this great opportunity for having me here. My name is So Min-u. I am one of the community leaders in Burmese community. COVID pandemic impacted everyone across the globe, and our Burmese community here in Fort Wayne is no different. Many of our community members were infected and severely suffer from this illness caused by COVID-19 virus. And we lost many community members, including one of our own leader, Pastor Joe Nine, who is known for his caring personality. Life is not the same, and for many families, it will not be the same again. All our public gatherings, including our fundraisers, our community gatherings, festivals, prayer service at the churches, mosques, and the temple were all closed last year because of this pandemic. Without such gathering, we've become distant from one another. But public health is more important. Over the last year, we worked with Allen County Health Department closely to increase awareness within our Burmese community. And we did several community outreach, and we make sure we play our part to prevent the spreading the virus and to contain the risk. We waited over a year for this pandemic to be over. And we all know it is not over yet. But the vaccine is a hope. It is a hope that we can overcome this pandemic together. It is a hope to go back to our normal life, even better. And it is a hope that our life, daily life, will resume as the normal. So we encourage everyone to go out and get the vaccine if you are eligible. And I know many of our community members are getting vaccinated, and more are waiting to get one. So having a mobile vaccine site like this will make more easier to access in a short period of time. So I got my vaccination in April, and I can tell you this, it is safe and effective. Not only does the vaccine provide us preventing from the COVID virus, it is also an act of caring to the people around us. So I also want to take this opportunity to appreciate the leadership of Dr. Shitters and the hard work from Allen County Health Department for putting this together to make it happen in our city and our community. Thank you.
Good morning. My name is Gaby from HealthVisions Midwest of Fort Wayne. And we have a coalition, Allen County Health Equity Coalition, and we are able to assemble the vaccine messaging task force meeting with more than 30 members from different organizations. So we are working together to put an end to this virus. We know it's difficult because there's so many reasons out there. One is the language barrier, internet access, and registration, and sometimes transportation. So we're here to help all those people out there, especially people from our community from the South and Southeast. And our goal is just to tell the people, go and get your shot. This is the tool that we need to kill this virus. So please, we have everything that we are doing everything we can to fight this virus. We have interpreters, we have transportation, and we have many other tools that they can be helpful for all those people, especially the people that they don't have the internet or the language or other reasons. So we're here to help. We are working very closely with the 46803, 46806, and 46816. And we just want to bring the mobile vaccine clinics to them so they can get their shot, so they can get vaccinated. And that's our goal, raise those numbers so everybody can get their shot.
Good morning. My name is Peggy Hayes from HealthVisions of Fort Wayne. We are a faith-based organization working with the poor and underserved on the south and central side of Fort Wayne. And I just want to let you know that HealthVision was very instrumental in connecting with the Indiana State Department of Health and getting sites on the south side of Fort Wayne. And one of those sites is McMillen Park Center, which we're having a function today. So I'm there with the mobile site all this week doing the shots. So we hope that you come out and get your shot. And so we want to make sure that we're covering all the people on the south and central side of Fort Wayne. So come out and get your shots because this is very important. And we just want to make sure that everybody has an opportunity and have access to get these shots. So they're here from today until Saturday. So come out and get your shots. Thank you.
Thank you.
My name is Herb Hernandez. I'm here on behalf of the Greater Fort Wayne Hispanic Chamber of Commerce that we've been in existence over 31 years. And before I make my comments, I want to say thank you to St. Joe Community Health Foundation, the Foliner Foundation, for giving us the financial support to do exactly what HealthVisions Midwest of Fort Wayne, Indiana is doing. We are collaborating with them to take our message to the neighborhoods, which as Gaby has already given you the zip codes 46802, 46803, 46806, and 46816. We have found that it's very important for our Hispanic Latino community to follow the instructions of the physicians, the medical people, and the nurses in order so that they can continue to have a safe process of getting the vaccine. Wear your mask, not only for your health, but to protect your family and to protect your friends. Also, the church, the Iglesia de Ebenezer, that's located at 5514 South Anthony, I gave an announcement at their church on Sunday, May 16, that we would be providing vaccines and public awareness. Saturday, May the 22nd. And I mentioned to them that all they had to do was to present some form of identification, like a driver's license, birth certificate, to verify their proof of age. And when I said that in the church, several of the women in the church gasped. And I reassured them that this information will not be made public because this is due to patient privacy, medical privileges, so they felt a little bit more relieved about that. So I guess some things cross all cultures. But nevertheless, we also told them we're going to have another event this coming Saturday, May the 29th, again at the Iglesia Ebenezer that's located at 5514 South Anthony. Para los que hablan español, gracias a la Fundación de San José y de Folliner que dieron apoyo a la Cámara de Comercio de Fort Wayne. Es muy importante que escuchen y sigan las instrucciones de los doctores médicos de ponerse mascarilla para su salud, para proteger su familia y sus amigos. Gracias.
Good morning. So 2 questions come up for me. Where are we at, and why is this important? The first is where we're at. You know, we're in a much, much better place than we were a year ago. We're in a tremendously better place than we were this winter. We are seeing cases come down, finally. Across the nation, we saw this last month, and we were flat, but now we're coming down. Yesterday, we had 16 cases in the county. Today, only 20 will be reported. And that's fantastic news. It means we're closer and closer to getting back to normal. But the pandemic is not over. The majority of our citizens are still not vaccinated. Now, the early adopters, the healthcare professionals, large groups have overwhelmingly taken this vaccine, but there are some groups who have not. And they're not taking the vaccine for a number of different reasons. There's a small group that is fundamentally opposed to the vaccine, and I don't think will change their minds. But there are a number more who want the vaccine, are willing to get the vaccine, but lack the resources to be able to make the appointment, get to the appointment. Perhaps they're working 2 jobs. Perhaps English is not their first language. And as mentioned, perhaps they don't have internet access. All these are barriers. And so we are shifting from a mass vaccination, from trying to run a large, high-efficiency site, to trying to get the vaccines to where people are at, to make it easy for people to get a vaccine, to make it easier to get the vaccine than to not get the vaccine. These are all the way forward. There's also a group that can't get the vaccine because it's not approved for them, and that's children under the age of 12. And we expect that there will be approval, perhaps this summer, perhaps in September, but that by fall, these vaccines will be approved for almost all Americans. And Americans have been tremendously lucky. We've gotten 3 safe and effective vaccines. And these vaccines are not just good, they're great. They're better than what we expected. The rest of the world is clamoring for these. People in India and Brazil are dying and wish they had these vaccines, and we now have a surplus. We have more vaccines than people who want to get them right now. And that's a tremendous blessing. But we urge all people who are not yet vaccinated to take the shot. What we've learned from CDC is not only are these effective in preventing disease, they're effective in limiting transmission, so that as more and more people become vaccinated, we can become more and more back to normal. And so choosing to get the vaccine is both about your personal safety and about being kind to those around you, about not being a vector, about not spreading this disease without even knowing it because of the problems of asymptomatic and pre-symptomatic transmission. So why is this important? This is important because we now want to have multiple points where people can get vaccines easily. And for those who don't know, they're still free. They've been free from the beginning, and they're still free. So I would urge everyone who's not been vaccinated to get the vaccination. What you see here today is kind of a small, really the tip of the iceberg in terms of how we've come together as a community. So while in many things the health department has taken point, or maybe been the public face of that, there have been dozens, hundreds of people working behind the scenes to make sure that we knock down barriers, to make sure that we educate, to make sure that we combat misinformation. And a great thanks to all this, to the IDOH for providing leadership, for helping funnel the vaccines to us. This has been a great effort together. The pandemic is not over, but we're making significant progress. We are getting closer and closer to being back to normal. So I thank you all for being here today. This concludes our press conference. I think a number of us will be around if you'd like to do individual interviews. So thank you very much.